Hello and welcome to Gale Blade News. In today's news coverage, we'll be covering the problems to do with disabled people and the risk of being ignored as a result of the COVID-19. Almost two-thirds of people who have died of COVID-19 in the UK were disabled, new figures suggest, with disabled women more than 11 times more likely to die than their peers. Disabled People's Organisation are now calling for a full inquiry. Ginny Butcher, a 22-year-old wheelchair user, needs two personal assistants with her at all times. She is at high risk of coronavirus and is still shielding at home. She has a ventilated tracheotomy and says she has been extremely anxious during lockdown because there have been zero guidance on what to do if any of her assistants became ill or had to isolate. She points to the impact of the Coronavirus Act, the emergency legislation the government passed at the beginning of lockdown, which took away significant parts of councils' duty to provide care for disabled people. Critics said it gave councils who previously had an obligation to provide certain care the power to downgrade provisions for disabled people and elderly. Disabled women were left wondering how they were going to get out of bed in the morning, Ginny says. With much less care, women were forced to venture outside to get groceries and other essentials, putting themselves at risk. Those who do have care support have struggled immensely to get vital personal protective equipment, or PPE, she adds, saying this puts both carers and people with disabilities at risk. Ginny couldn't get any PPE for the first 8 weeks of the crisis, despite being on the government's list of people who are clinically vulnerable to the virus. It has been my biggest concern throughout the crisis, she says. It comes as the latest ONS figures showed more than 22,000 disabled people died from coronavirus from the 2nd of March to the 15th of May, making up two-thirds of all deaths. The statistics suggest working-aged disabled women like Ginny are more than 11 times more likely to die from coronavirus than their peers. For disabled men, the death rate was 6.5 times higher than non-disabled men. I'm not surprised at all, says Ginny. Hardly anything has been done to protect disabled women. In fact, the opposite is true. Disabled women are being abandoned and left to die. The ONS analysis suggests that much of the disparity is caused by social and economic factors such as region, population density, area deprivation, household composition, and occupation. Inequalities have been shown to disproportionately affect disabled people, but Chris Hatton, Professor of Public Health and Disability at Lancaster University, highlighted two key factors. He said disabled women and disabled people in general are also more likely to have other health conditions that can increase their risk of dying from coronavirus. People with learning disabilities are disproportionately likely to be obese, have diabetes, or have kidney disease, he adds. Crucially, he says people with learning disabilities often develop these conditions at a relatively young age, which could explain why the difference in death rates is particularly pronounced when it comes to young disabled women. The second factor, Professor Hatton says, is that disabled people often have their health concerns overlooked and diagnoses are often delayed because new issues are assumed to relate to existing disabilities rather than a new condition. Those same issues have spilled over into discrimination in coronavirus treatment. At the end of March, the National Institute for Health and Clinical Excellence, NICE, published guidance which appeared to recommend prioritising coronavirus patients based on a dependency scale. People who were highly dependent on others in their daily lives would be the first to be denied intensive care in the event that units became overwhelmed, regardless of whether they were clinically less likely to survive. While hospital ICUs never exceeded capacity and the guidance was partially rescinded, Professor Hatton said it badly damaged confidence among disabled people. Medical professionals do not listen to disabled women and often gaslight disabled women into thinking that they are not sick, unwell, or in pain, Ginny adds. I'm not surprised that disabled women are failing to receive the medical treatment that they need. Ginny says more needs to be done, and disabled people's organisations agree. It feels like there has been a systematic failure to understand and address the needs of disabled people, says Mike Smith, a former commissioner of the Equalities and Human Rights Commission, who is now Chief Executive of disabled charity REAL. He says an inquiry needs to be looked at all the structural inequalities disabled people face. All the way through this pandemic, there's been a narrative to the wider population: don't worry, it only affects older people and those with pre-existing conditions, as if somehow the value of those people's lives were less. Leading charity Disability Rights UK agrees. We would want to know whether there are things that could have been done differently, such as earlier provision of PPE, earlier provision of testing, speedier diagnosis, access to critical care, as well as tackling increased isolation, says the charity's policy maker Fazilet Hadi. A Department of Health and Social Care spokesperson said the government was determined to take the right steps to protect those who are most vulnerable to the disease and minimise their risk. More than 2 million people have been identified as clinically extremely vulnerable, and we have provided guidance to GPs and clinicians so they can add people to the shielded patient list, as they are best placed to advise on the needs of their individual patients. The department said the care provisions implemented in the Coronavirus Act are only intended to be used when absolutely necessary and should be temporary. There are no plans to extend shielding for extremely vulnerable people beyond the end of July, but Public Health England continues to monitor the effects of the virus on different minority groups, the department said. So what do you think of the ongoing situation with disabled people? Do you have any relatives who are in that situation? Have you ever experienced any kind of disability? And are you concerned for these types of people that they're kind of put to the back of the queue? Whatever you think, leave your comments down below, like the video if you enjoyed it, and don't forget to subscribe.